Hello and welcome to our next edition of Superintendent Chats, or Super Chats as we are calling them. My name is Jorge Luis Arredondo, Superintendent of FAR San Juan Alamo ISD, and I'm here today with none other than our PSJA Health Services Director, Zulema Solis. Thank you for joining us.
Thank you for having me, Dr. Arredondo.
Absolutely. Now, throughout our school closure, one of the most important needs we have been able to ensure is the safety and health of our families and staff. You and your entire team have been essential to our district, and we thank you from the bottom of our hearts for your efforts. Since March, you and your team have helped us monitor situations and to ensure that we stay up to date with the latest updates with coronavirus and everything that entails in terms of following the CDC guidelines. Do you want to share a little bit about how you've been able to support those efforts?
I sure can, and thank you for those words. We, as health services, that's one of our primary jobs, is to monitor any communicable disease, try to prevent and possibly contain any communicable disease. So, I mean, we deal with this basically on a daily basis. Our job is to, of course, report and monitor and do what we can to try to take as many preventive measures as we can. So initially, we had been monitoring for flu-like symptoms, so that we could we do this basically throughout the year, and we monitor the numbers. We're able to send out teams together with our maintenance department. They go out there at any time of the day. They'll go out there at night if we tell them we have an increased number at this school, in this classroom. Awesome. Yeah, so we work really well together. We have a fantastic team there at maintenance department. And like I said, at any time of the night, they'll go out there, they'll fog a classroom, they'll fog a whole school if they have to, and awesome. Disinfect them. So so our team has always done that. And so when COVID-19 came about, it was just all hands on deck and working real well with the maintenance team and getting the infection contained as much as possible within our schools.
Thank you. Thank you very much for that and your efforts and all the nurses. Now, your team has also been instrumental in providing health screenings. I know when we've been out there on the front lines, providing food to our families. Can you share a little bit about what safety measures and why those are so important as we have people out there serving food and we want to make sure that they are safe? Can you tell us a little bit about what measures we're taking to ensure the safety of our employees?
Sure. So we strategized and we came up with a fantastic plan, I think, because we really looked out for the safety of all of our staff and the students and families coming to pick up meals, instruments, athletic equipment, academic materials, even their medications that were left at school. We took all the precautions necessary. We ensured that there was enough feet away from the families, and it was delivered on a table that had been that was disinfected at for every individual pickup. So we had a good 16 feet away from the pickup area, and the table was set at a good distance of 8 feet from the individual vehicle, picking up meals, like I said, instruments, anything like that. And the crews out there were fantastic. Everyone out there helping to disinfect between every single vehicle. So we all had personal protective equipment, and that the school was able to provide to all of our staff. So we just work really well together. We have a great team.
That is awesome. I know I got calls from other superintendents throughout the state about the efforts that we were making. We know that many districts were out there ensuring that we were providing meals, but the safety efforts that we were making here at PSJA were second to none. And so thank you for your efforts and your leadership for you and your entire team. Something else that you and I have been collaborating on was what's going to be the next phase. And you and I talked early on about how important it is to ensure that our community had opportunities for testing. I remember that first week when we were collaborating about, and when we were off, you said, you know, there's not too many testing in the Hidalgo County, and particularly in our community here in the FAR San Juan Alamo community. And now we have our very first ever testing site here in Hidalgo County. Do you want to share a little bit about why that's important as we continue to flatten the curve?
Absolutely. So we know that that's going to be the best way, right, is to test members of our community, individuals that are symptomatic so that we can determine, okay, are you COVID-19 positive? Can we give you the best care that you need so that you can go out and seek care if you need to? And so we felt like a responsibility as a district to provide that to our community. And so I'm real grateful to you to help me work on that measure, and also to our board members for approving it, and also advising us that it would be best to have it in all of our schools, not just one particular campus. So we're very fortunate that we found a local healthcare provider that we can work with. We're able to provide the services at, with insurance or at $100 for the testing. So, we did have a line of vehicles yesterday. Yesterday was our first day of opening. So we're real happy that the community is taking advantage of this. And we're the first district to actually start a testing site. Other districts have had testing in their area, but they've been designated by the state. We're going to host a testing site at your campus, but we're the first to actually initiate one as a district. So I'm very happy that I've had your support to do that.
Absolutely. Anytime we can do something to benefit our community, that's something that the PSJ family is committed to, our school board is committed to, and I'm just happy that we are providing it in every city within our district. So that is awesome. One other thing that I like to be able to share with our viewers is, first of all, your continued efforts to continue to serve our community. What quick 2 or 3 things that would you like to tell families out there as they continue to do the things to stay safe from our health nurse? What could you share with them?
Very important. Don't continue to use safety measures. Continue to wash your hands. Continue to wear masks anywhere you go. The disease is still very serious. It's still life-threatening. We have to continue to take it serious, even though there has been some restrictions that have been let up, but we still need to continue to take all safety precautions for ourselves. If anyone is sick in your family, I recommend that you open windows up, ventilate your house, clean all the doorknobs, disinfect them, spray them all, even the vehicles. Just air out all the home if possible, even if it's not COVID-19 or you haven't been tested yet, you have flu-like symptoms. The best thing is to disinfect the household as much as you can. Stay home if you are feeling any of these symptoms. Don't come out into the community, and maintain your distance from individuals. Still, that 6 feet, that's the best way to go.
Absolutely, thank you for that. And then for our awesome students that are out there thinking about the healthcare industry and the work of being a nurse, you're a first-generation college going person as myself, and one of the things that we want to do is continue to inspire our students to go into careers where they can benefit others. Do you want to share a little bit of words on your career and what advice you would give our students?
Sure. So I started off as a medical assistant, and I went back and I went to RN school, and then I felt like there was a calling to do a little more. I could do a little more as a family nurse practitioner, so I went on to do that, and it's such a rewarding career. Today is National School Nurse Day, and so I'm so appreciative of all my nurses. They're so compassionate. They say, what else can I do? How much more can I do? So I feel like all of us are, have an instinct to want to help. So if you have that and you want to pursue that, this is a career for you. This is a career where you can help. It's so rewarding at the end of the day. And you can come home and say, I've made a difference. So look into this career, whether it's a registered nurse, a family nurse practitioner, a PA, or a medical doctor. It's a career where you can make a difference.
Thank you very much, Zulema. You and all our nurses are making a tremendous difference. And thank you for joining us today. On behalf of the entire PSJ family, thank you and our amazing nurses for their commitment to our district and to our community. And to our viewers, thank you for listening. Make sure to follow us on social media and visit our website for the latest news. We pray for your continued growth in mind, health, and spirit. Stay safe, PSJ family.